Hey, good afternoon, everybody. Scott Fischer back with you. Our next episode of Don't Let Haboob Hit You in the Face. This is my metaphor. If you look over my shoulder here, this is a metaphor for what happens in the lives of so many of our aging loved ones here in the greater Phoenix community. We have 160,000 80-year-olds already, a million folks already over the age of 65. We have a top heavy aging community. And for so many, there are things going on in people's lives that are real. Sometimes they're very subtle, sometimes they're quite noticeable. But for so many people, they often put their head in the sand or they ignore what's going on and unfortunately leave themselves exposed and open to haboob, that big explosion that happens. And the pictures over my shoulders are pictures that happened this summer. That's Arizona State University getting swallowed up. And I think that people that are having crisis and having these experiences with the lives of their loved ones often feel that swallow up feeling. So today I'm going to bring in another one of my buddies. Lori Stauffer is with us today. Hey, Lori.
Hello, how is everyone?
Oh, man. Thank you for being here. Lori's with the city of Scottsdale. She's one of the public information officers there. She manages and oversees a lot of their community outreach programs. The community risk reduction program is their home safe home program. Lori, you told me a number. I think it's pretty, tell me if I'm wrong, that the city will pick up or touch about 5,000 individuals this year in their homes or in their place of residence that are just responses to need. And you guys, as an agency, go out and touch those people. Did I
Well,
get that right?
so let me get it even more specific. So the 5,000 calls that you reference are
Yeah.
just falls. We get
Just false.
43,000 calls a year now, and 5,000 of those are falls. That's just falls. That's 125 fall calls a week.
Oh my gosh.
Yeah, we do a
Well,
lot.
thank you for, and you're Scottsdale. You're not, I mean, that's just Scottsdale, not Chandler, not
Mhm.
Phoenix. Insane.
Yeah.
Wow. Wow.
This
Wow.
is
Wow.
this is a huge problem across the country. But in our community and in our area, we're very desirable. Scottsdale definitely is, but the Metro Phoenix area is because of the warmth that we have. We have a very large aging community. So we need to do some things to help people stay in their homes safely. Let's not
Yeah.
have to call the fire department. Let's do some things to keep you guys safe.
Yeah. I bet I've got some questions for you, but talk a little bit about maybe as you get started, what drew you into public service? How did you land at the city? You've told me that story, but share with our audience how you got here and why this is such a passion for you.
Well, it's one of those winding roads. I actually went to school for journalism, so I worked at a newspaper for about 5 years. Moved out here, worked at a company, and learned about how to do websites and training and designing documents. And then I moved to Phoenix Children's Hospital, and in the communication office, I was the liaison with the Injury Prevention Center and the foundation. And when you're tied in to that specific those departments, and then you're working with that community, injury prevention and trying to keep kids safe and not get hurt, of course, was a huge thought. And at the time, I was actually raising small children, so it was a great fit. Well, the fire department here in Scottsdale became a city department in 2005. Prior to that, Rural Metro provided their
Oh,
service,
Metro.
but we became a city department in 2005. So we're just a little more than 20 years old now, and I got to be on in the ground floor charter member, and I have been in this community relations realm here at the fire department for since the beginning. I focused a lot on kids because that was my knowledge point at the beginning, but as you know, as people left and my responsibilities grew, the Home Safe Home program came to me and we said, okay, how can we do this better? Now, this is the challenge with all fire departments, right? So this is not just Scottsdale, this is fire departments across the board. We have this fall problem. We have so many people who are falling. It's typically the number one call to any of the fire departments. So we need programs, right? What I have seen and what I experienced is that when I took on our Home Safe Home program, it was a beautiful program, but it really just focused on assessments. It had an exercise element to it, but when it came to follow up and ensuring people were doing the things that they needed to do based on those recommendations that we came on, there's not a lot of follow up. So across the board, I think a lot of fire departments struggle with we've done the assessments, we've raised your awareness, but there's not a lot of help to complete that process, especially with those who have what I call our level twos, especially our level threes. They're falling a lot. So level two for me is more between 1 and 8 times. Level 3 is more than 8 times, and we do have some individuals that do. We have been working to implement since 2020, and the process is slow because we need to have all of the pieces and parts in place. We partnered with Right Care, and the 10 years prior to that was really that data-driven program of, we know specifically what the risks are. We have to lower the risk profile for that individual, and then we've lowered their risk of falling, and we have so much more success with that than if
Right.
we just keep going, well, this is their risk, this is their risk, this is their risk. And every time they go to the hospital, the risks go up. And how many times have we taken people? I said my level twos are 1 to 8 times. A lot
Yeah.
of those times the people are going to the hospital. I learned today that in one of our hospitals out of the rooms in Scottsdale through the Honor Health system, just one of those emergency rooms for just trauma, not any other thing else, 4,000 individuals have visited that hospital system for trauma. So individuals, not I've come here 20 times. It's 4,000 individuals for trauma into that one ED alone. And that's for falls. The mechanism of injury is something that had to do with a fall. That's 4,000. And these are traumas, which then we
Yeah.
know that if we don't take care of them,
Yeah.
when they leave the hospital, they're going to end up back in the hospital again.
You mentioned something, and I'm so glad you brought it up. I've been inspired, and I've been around the valley since 1979. And I remember on the news at night, the battle cry in the 80s and the 90s was watch your kids around water. 2 seconds is too long. I remember when that wasn't a thing, and I remember when it became a thing, and it is still a thing. The focus and the emphasis and the messaging has been on saving our kids' risk. It well needed, because every night in the summertime, the guys from somebody's city fire department were pulling kids out of pools. So you know that, you were there. Here's what I think our new battle cry is. It's our turn now to love and care of those who loved and took care of us. See, as adult kids, our parents are aging out. We want them to age safely. We want them to age in place. We don't want to put them in places. We really don't. We
Right.
do it because we don't have any choice, or their safety has been so impacted. We have to do this. And so I feel very emotional. I've been through this with my own mom, up to the point where 3 weeks ago we just lost mom. I mean, the natural aging is happening. Death is a part of that, but it's our turn now as a community, as adult kids, to step into the gap and solve this problem, reduce the risks, reduce the numbers of falls that are. Any idea how much that costs to run them trucks 5,000 times for falls?
It's a lot of
A
money.
lot of
Yeah.
money, right?
And it's funny that you bring up the drowning situation, because I've been very intimately involved in the Drowning Prevention Coalition. And when they started talking about that in the 80s, there were 64 per 100,000 kids, just kids, were having some kind of water related incident at the time. It is now, 35 years later about. So
Yeah.
we know, or maybe up to 40 at this point, that we know that we're down most years. Last year was a tough year. Most years we're about at 8 per 100,000, and our population has exploded. Now I bring that up because the work that was done, we've talked to people about swim lessons and got pool fence ordinances in place, and we're doing all of these things. We've been working really, really hard and beating the drum. We, as I agree with you, need to be doing that now for our older adults, that many of the falls are preventable. We can
Mhm.
give these folks quality of life as they age, recognizing that the body does change. We will have to change. We live our life just because our bodies are not working the way that it did. We're
Yeah.
never going to be back to that 20-year-old magnificent body that we all functioned around.
I'm not as good as I once was.
So we know that people fail. It's not, and there are, yes, I don't want any hate from anybody that says,
Yeah,
listen, I climb Camelback every day
yeah,
and I'm
yeah.
87. Good for you. That's so cool. But not everybody is
Not
doing that.
everybody
And they
does.
didn't prep that. And quick little aside there, my dad was extremely active. He hiked on a regular basis, skinny little dude. He just loved it. I'm telling you, he started to experience some pain that kept him not as active. Then 2020 exacerbated that because they weren't able to get out and about. They were. His muscles atrophied. He passed in 2022. Yeah, 2022. So in 2 years, he went from active adult to, where we don't want to end up
Yeah,
when we can be extending our life at least more safely. And it is funny because he was falling and so I would wring my hands. I'm like, this is what I do for a living. And I'm still struggling with this. So kids, we know that you are challenged with this. We know that you want your parents to be aging safely. Parents, we know you want to be aging safely at home, but we've got some things that we need to address. And some of those
yeah,
are going to be those tripping and falling hazards and addressing some of that body changing that's going on.
yeah. We have to understand it and accept. I was having a conversation with a gal this past week on her podcast about the challenges that are as adults. I guess it's across the board, really have at accepting those new realities and those new changes, and we personalize it in as if it's something wrong with us. There's a shame kind
Mhm.
of attached to that aging and failure. And man, I talk to people all the time about we have to change the narrative. We changed it with the kids thing. We made an impact. Look at the numbers. There's more to pick from, and numbers have still gone down. And I know I got buddies of mine that are on this Arizona Falls Prevention Coalition. We have a mutual friend, I think, that's a Phoenix firefighter that's been a big player and all that. And he goes, we've not reduced falls one iota. And we've been meeting for a dozen years over there at the state. And so it's now time, I think, with this right care methodology that we're introducing in the city of Scottsdale, we're proud to be a part of that team to implement those assessments and prescriptive strategies to reduce that scores, reduce those risks, give people better quality of life, reduce burden of care, right? Those things that are so fundamental to people's success and safety at home.
And there are even some really simple things that even we can talk about today that if they implement some of those simple ones. But bottom
Yeah.
line is we know that there's 144 specific risks. We know that there are things that people change to reduce the potential that the next fall is their last fall.
Yeah, because it's real. The numbers in the EDs, as you just said, are bearing it out. So it's not just fall and get me up, it's fall and big problems. Haboob is happening.
Yeah,
Um,
absolutely.
I imagine you, if I asked you this question, said, I wish more people would. You would have an answer or something to fill in the blank with that. I wish more people would do.
My challenge is I never have just one answer.
You go right ahead and take the time.
But the big one is the first thing is accept that our bodies are changing and that we need to start thinking about it now. One of the things that I learned at a community risk reduction conference in November was we need in our 40s and 50s and 60s, we need to keep our strength in our muscles. We've got to keep our muscles. And the big thing is we start falling at age 50. That can be life changing. I know I make my chiropractor very happy with all of the money that I pay the practice in trying to fix some things that happened because of some falls that I've had. So we have to start let's do 10 squats a day. 10 squats. And that for older adults can be stand up, sit down from a chair or a sofa.
Yep,
Let's
yep,
work those leg muscles because it's the leg muscles that are going to keep us. You can be strong up here, but man, if you don't have strong legs, you're not going to be
yep,
able to do it. They also
yep.
recommend that doing 10 lunges, both left and right, just keeping that muscle tone. So understanding that we can stave off some of the challenges with falls if we kept our muscles stronger and addressing those. So we have to recognize that we shouldn't wait until we're 75 to
Yeah,
start addressing these things. I think that's
yeah,
probably the biggest one. We have to
yeah,
start looking at it now in our 50s and 60s so we can go, hey, how do I reduce my risk? It was interesting when we first started talking about this program that we do have a lot of people who have fallen, but we were also visiting folks who their risks were really low. And the conversation I was having with the person was, why are we going on this? And this person, they're getting ready to go to their yoga class after our visit. Because they're being proactive, and that's what we want. We want to say, hey, here are the things that you need to think about as you're getting older. You need to think about these throw rugs. You need to think about all of these different little elements in fall prevention, and that when you start to struggle with this, we need to get the grab bars in there. And any that any kind of injury, particularly back injury, should think about putting grab bars in their bathroom for their toilets. I always laugh that the last place I ever want the firefighters to have to come visit me and help me out is when I'm in the bathroom, whether I'm,
Yeah.
because we pick people up
Yeah.
because they've fallen off the toilet or fallen in the bathroom. Not a place I want to be. And that's really where we need to go. These things should be in our homes anyway, but we need to start thinking about it's time to get those in once we probably hit that, at least that 60-year mark, so you're not waiting until it's too late.
Well, bravo to Scottsdale and for you to see that right care methodology in the program could really make an impact in Scottsdale. As you might be talking to others that work in other city roles, yours or other aspects of city government, what would you share with them from your perspective that what their cities could incorporate or what they should be thinking about? Or because I think what you just said lends a lot to that conversation about, and get the Gen Xers and the end of the boomers to be talking about this, not wait for our parents, but we need to be talking about this and
Yeah.
incorporating those healthy practices.
Again, we start falling at age 50. That can be life changing. We fall out after the age of 65. That can be life threatening. So we have to start thinking about it. And we also have to know that it's not just the grab bar that's going to change us. You could have a person who, for instance, has Parkinson's sitting next to a person who has Parkinson's, and their struggles are not going to be identical. So we also have to really go, okay, what's that risk profile? What does that look like? We need to come in and really look at your individual situation so that we can address those specific things so we can get your score down. It's the same as if we were helping you with your car seat. We don't just say, oh, every car seat in every car is exactly the same. Never. Come work with me on a Saturday and I will show you how all of them are different. Even if it's the same car seat, it's different in this other changed car. So we really need to look at what it is that we can do as far as the falls. Now, when talking with other departments or other governmental entities, number one, you need to have your partners in place. So I super appreciate you, Scott, and the things that you are bringing to the table with your team, because it's not just identifying the problems, we have to fix them. And that will take a team, which is one of the reasons why I said we've been talking about this since 2020. This is one of the first times that RICARE is working with a fire department directly. They've been working in faith communities. Faith community is going to be a partner at the table, but we also have to talk about home health. We have to have our hospitals on the table or at the table. So all of those people need to be there, and they need to agree that the case management of these individuals of this so that we can protect them. It's amazing to see that people think they're doing the right thing, those residents that we're helping, but nobody has actually really taken the time to look at, oh my gosh, you're freezing with your walker. Let's get you in your wheelchair. Let me see you get from your wheelchair to your walker on your own because your wife's not home. That's a scary proposition. So we have to have all of these people in place so that individual still has their dignity. They're not falling. They're not potentially causing life-threatening injuries to themselves, and their quality of life is better, and their caregivers have a
Yeah.
higher quality of life as well.
We were out, my wife and I were scoring two individuals, husband and wife, in Scottsdale, living at home, different health issues, both of them. They scored low enough to stay safely at home. The things that we identified were clearly going to continue to be more problematic, and they were going to be adding more risks in the short run. And it gives us data to go back and talk to them specifically about these are the things we can manage to reduce now to get your numbers even lower, or these are the things that you may not see as problematic. Most of these guys build these beautiful bathrooms and they have glass enclosures everywhere, and they want to put a shower chair in them, and then the shower chair isn't really supported right, and they have big accidents. You said buck naked with the water going everywhere, and they're on the ground, and they may be there for 2 days in their shower, and they can't reach, and glass is broken, and you just go, there's some real problems with this. Was designed for a healthy 40-year-old, not for a 75-year-old lady that has neurological disease or a husband who has advancing dementia. I mean, this is not. So our next project is to launch a chapter of the National Aging in Place Council. So work with our Right Care mission. And that's a national organization, Lori, coming to Phoenix now, called the National Aging in Place Council, a nonprofit entity to go out and continue to elevate the conversation nationwide. And I'm going to be chairing that group coming to Phoenix in February. So more to come. I'll be letting that. So Scottsdale residents can know where they can get, again, additional trusted, vetted resources that are.
Well, and I'm telling you, that story that you just shared is repeated over and over again. And these are in homes a lot of times, because that's one of the things that people get confused about. I visited a home in North Scottsdale, and you were absolutely right. It was designed for a healthy 40-year-old and not to these two people who could not get around without their walker. And they had step after step up and down and in and out, because it reflected the elevation of the beautiful mountain that it was. And the challenge that we're all going to face in this arena of those who are trying to help is that getting the folks to accept the help, that recognizing they have to recognize that they're at a risk. Because this lady was explaining to me how she would take a shower and she would use the soap dispenser to help her get up and down.
And they think the towel bar, think the towel bar is as good as the grab bar. The towel bar just comes right off the drywall when you put it on.
And it's really scary. It's really scary. And emergency response is there to help you when you have gotten yourself into a situation that is just not healthy for you in that moment. But we also have more ways to care for you through engineering, again, with grab bars, et cetera, through, understanding medical condition and what kind of meds are you on and what are the things that maybe we can adjust, and really getting the folks to understand that you don't have to fall. We are all eventually going to move on to the next plane, but let's not do it faster than we need to.
Right. Amen to that. I feel like I could talk to you for another hour. I wanted to just kind of bring us in for a landing, at least on this episode, and come back and do this again with me 2 months into this, kind of maybe do a recap of where we're at with Right Care and starting to see some of the fruit of all that hard work you and the city have invested in and all the players that are involved. Just to illustrate Haboob and bring it home, is there a scene where you've just maybe seen it coming with a particular family and then the big one hit and it really shook you up or really caught your heart, that you would want to maybe leave us with and share that story?
There are so many, but one in particular is an individual who had medical issues. He unfortunately wasn't helping himself with those medical issues, but he also had lost strength in his legs and was using a walker and trying to get around. And sometimes he would use his cane, and he had one of those little medical devices, right? So he would call 911. He also called 911 to help him move from one chair to another, maybe to help feed his dog. And so I had to go out there and meet with him and say, sir, we need to figure out how we can help reduce your calls to 911. There are ways that we can do that. He goes, well, I don't call 911. And I said, I'm sorry, what? Explain. And he said, well, I pushed my button. The fire department is not your personal concierge, sir, but I appreciate the thought. But unfortunately, we would see this, and he would call almost every day or every couple of days. And the firefighters just knew that he and the people around him were very resistant to putting the things in place that could have helped him be more comfortable, that would have resolved a lot of those issues that he was calling 911 for. And that's when you talk about the haboob, we knew what was coming. And within a year of that visit that I made with him, he'd passed
Yeah.
away. Yes, he did have a medical condition, but many of the things we could have adjusted for him that potentially could have extended that and reduced the amount of emergency calls. It would have been a lot more comfortable for him and again for those around him.
I, for years, have done a talk, and when I do this particular presentation, and I've called it the Storm Clouds Talk for years, but I'll make a joke. I said, listen, if your loved one knows the day that Cody or Corey or Jacob is working from the fire department, they know, oh, Cody always works on Thursdays. That's not good. They've gotten too acquainted with the guys on the department and
That is so true.
their local station. Hey, thank you for doing this. Bravo to you in the city, and thank you for allowing us to be a part of just a little role in this as we start to roll this out and make that impact that we hope for in the city. And thanks for the great work. And I think showing leadership to the entire community, because I think all of us in Phoenix are looking for those bright spots. So congratulations and bravo. Thank you for
Thank
hanging
you.
out with me a little bit. Yeah. Let's do this again. All right. You
You
guys,
got it.
thanks for joining us. Lori and I just want to say thank you for joining us. We've had a great time talking to you today. Don't let Haboob hit you in the face. We'll talk to you soon. Take care.